Lassa fever is a deadly seasonal disease in Nigeria caused by the multi-mammoth rat species with symptoms like the hemorrhagic fever. This is our focus today on sound health. I'm Olasunbo Modupe. Welcome to the show. Okay, it's still Sound Health on Lagos Television, and today I have with me Dr. Oluwatoni Adeyemi. She's going to give insights and some precautionary measures on how to stay safe. Welcome to the show, Doctor.
Thank you for having me once again.
It's quite unfortunate that at this time of the year we keep having reoccurrence of the Lassa fever infection. What could be responsible for this?
Okay, Lassa fever virus has been known to or have a seasonal pattern. So usually between November and May, the dry season, we have a lot of cases of Lassa fever. It has also been attributed to some of man's activities, which include bush burning. Usually during this dry season, a lot of people start burning bushes, and this drives the rats away from their natural habitat, and they start gravitating towards where humans actually stay. And from human interaction with these rats, then the rodents to human transmission of Lassa fever is possible. So it has been established that it has a seasonal pattern. So that's why you don't have Lassa fever all year round. It's only when these rats have been pushed away from their natural habitat, they interact with man and they pass the virus. So it has a seasonal pattern.
Okay. What exactly is Lassa fever, and is it only spread by rats, multi-mammoth rats?
Yes, Lassa fever is a viral hemorrhagic fever. So it belongs to the same class and family as Ebola and yellow fever and dengue fever. They are all viral hemorrhagic fevers because their complication leads to bleeding. That's why we call them viral hemorrhagic fever. And it's transmitted by the multi-mammoth rat. The multi-mammoth rat, currently in Nigeria, it has some states where we have more of the multi-mammoth rat, where they breed. Benin City is one of them. We don't have them in Lagos, thankfully. But then, apart from the rats to human transmission of Lassa fever virus, there's also the human to human transmission. So if somebody with Lassa fever, let's say from Edo State, travels down to Benin, it's possible that the person can transmit from one person to another from contact with the body fluids of the person. That's why Lassa fever virus, we found out that it's more common among healthcare workers. They are the ones, or caregivers of the sick people, because they are the ones that have close contact with these affected people. That's why now in hospitals, anywhere they take care of the sick people, we're advocating universal safety precautions. At all times you're touching a patient.
What's the essence of the PPE, the personal protective
Exactly. So anytime you're touching a patient, you always ensure that you're properly gloved. If you need to wear your gown, especially surgeries, you wear your gown, you're properly kitted. And hand hygiene too is very important to prevent against Lassa fever virus, because the virus cannot stay long. Once you wash your hand immediately, even if you mistakenly touch an infected fluid, it helps and it actually goes a long way.
So what are some of the symptoms members of the public should watch out for when they suspect
Lassa fever infection, the viral infection, the symptoms are actually non-specific, but usually there is a fever, there is headache, there could be back pain, there could be chest pain, nausea, vomiting. So as you can see, all these symptoms are really non-specific. There are symptoms that you could even have in malaria, but most often there's fever. In complicated cases of Lassa, which you would hardly ever see, it's like maybe 5% of cases. That's where you actually have the classical bleeding from the nose, bleeding from the ears, from the mouth, and every other orifice in the body.
Okay, above all, if you look at all of these diseases, people don't report cases early enough to the health centers. What advice do you have for members of the public to start with, and what do you want members of the public to do in terms of preventing the invasion of rats in our homes?
Okay. Environmental hygiene is very important. It cannot be overemphasized because luckily a causative factor, an agent that carries the Lassa fever virus has been identified, and it is the rat. So every barrier possible to keep the rats away from your home and away from your food is actually what you should do. So environmental hygiene is important. Check around your surroundings. If you have holes in your house where you think these rats could possibly enter through, you need to block them. Your food substances, your dry food substances like your gari, your rice, your beans should be properly covered, such that, because the Lassa fever virus is transmitted from the urine, the feces, the saliva, the blood of the rat. Anything the rat has contact with, it can deposit the virus into it. So you need to cover all your food substances very well. Then you should not have breeding sites. Like, you shouldn't leave your refuse open around your house, because these are things that attract the rats close to you. So environmental hygiene, very, very important. Clean your house, clean your surroundings. Once you notice that rats has eaten any part of your food, don't try to manage and eat the remaining. You need to discard it immediately. Oh. And also, finally, for those that sun dry their foods, like maybe gari and sun dry cassava to make gari later, you need to ensure that you do not do that during this period, because it's susceptible to rats coming and urinating and defecating in it, and you would not know.
All right, thank you so much, Dr. Adeyemi, for giving your insights on Lassa fever.
Thank you for having me once again.
Proper hand washing and early medical help will keep Lassa fever at bay. That has been Dr. Oluwatoni Adeyemi on how to keep yourself safe from the Lassa fever. Sound Health continues in a moment. Please stay with us.
World Cancer Day is it's a day that is highly celebrated all over the world. It's a day that reminds us that cancer is real. It's a day that reminds us that there are people living with cancer, and also it's a day to remind us that we need to do something about cancer spreading all over the world. Which includes enlightenment, advocacy, screening, early detection, basically, the new trends of treatment, where we were, where we are, where we're going. Basically, how do we change the narrative? People used to think that when they have cancer, it's a death warrant or death sentence. It is not a death sentence. It's only a matter of early detection, doing a regular screening, and when it's diagnosed, basically go early for treatment. Go early for treatment, and when you're treated, comply with your doctors. On the side of the people, I know people still talk about stigmatization. They don't want people to know. There is nothing like that. I mean, it's better to come out early and get a treatment, not that you now patient presents in late stages where there is no solution. On the side of the government, basically, I mean, the government should, I know the federal government is doing something on trying to make sure that all the centers have radiation facility. I mean, in the whole Lagos State doesn't have radiation facility as a state. So, and there are quite a number of patients that we see that need radiation. the government should help expedite action on getting a radiation facility to those centers, even at subsidized rates, that it will not be cut. The patient will be able to afford those. Then also, on the side of the healthcare givers, we should make sure, this is just a day to remind us that cancer is real. We should make sure that patient care is the core of our goal. Whatever it is we're trying to achieve, know that, okay, we're aiming for our patients getting better, getting qualitative care.
Maintain personal and proper environmental hygiene to kick Lassa fever out of the country. This is where we say thank you on today's episode of Sound Health. For comments and inquiries, please send SMS to 08035826603 or follow us on social media at LTV Social, #Sound Health. A sound health is a sound mind. Make healthy living your choice.